Hello, and welcome to UCA's webinar, Staying Afloat During COVID-19, Resources for Urgent Care Centers. Camille Bonta, UCA's Policy Consultant and Principal with Summit Healthcare Consulting will present today. Thank you so much, Camille. I'm going to go ahead and turn it over to you.
Thank you, Carla. At the Urgent Care Association, we understand the challenges that are confronting urgent care centers during this COVID-19 pandemic, including access to personal protective equipment and COVID tests, as well as staffing challenges and a severe drop in patient visits. And while urgent care centers are working to innovate, including through telehealth, we understand that the financial impact is dire. The purpose of this webinar is to share relief opportunities that have been made available through congressional and administrative actions. The Urgent Care Association also wants urgent care center providers and operators to get engaged and ask Congress for additional relief, which we'll cover at the end of this webinar. Congress has passed 3 relief packages in response to the COVID pandemic, the third of which topped $2 trillion in relief. During this webinar, I will review 4 aspects of the Coronavirus Aid, Relief, and Economic Security, or CARES Act, the Payroll Protection Program, the Economic Injury Disaster Loans, $100 billion in relief for providers, and Medicare sequestration suspension. The most consequential relief provided in the CARES Act is the Payroll Protection Program. Congress allocated $349 billion for the program. Small businesses, including physician practices, can apply if they have 500 or fewer employees. Loans of up to $10 million are available and can be used for payroll and other certain expenses. The amount an entity is eligible for is 250% of the entity's total monthly payroll costs. Now, a loan can be forgiven if it is used to maintain employee and salary levels during an 8-week period. For any portion of the loan that is not forgiven, the term of the loan is 2 years at an interest rate of 1%. These loans are being processed on a first-come, first-served basis, and they are available until June 30th, until the funds run out. Congress is currently discussing infusing more dollars into this program, and that could come as soon as April of this year. More information about the program is available through the Small Business Administration website, and interested entities should begin compiling necessary information such as payroll, tax, and unemployment filings, and you should contact an SBA-approved lender, and it is recommended that the starting point be with a financial institution with which you already have a relationship with. UCA and other provider organizations are hearing that there are eligibility barriers for practices that use a professional employer organization to provide payroll benefits. So if you use a PEO, it is advised that you talk to your lender about all of your options, including applying for other loans through the Small Business Administration, one of which is the Economic Injury Disaster Loan, or the EIDL. So the EIDL is also available to small businesses. Applications for the EIDL can be filed online through the Small Business Administration at sba.gov, and applicants can receive up to $10,000 in advance on the loan, which does not need to be repaid. Now, however, there are rules on how the loan can be used, and entities can apply for both the EIDL and the Paycheck Protection Loan, but it's important to note that the loans cannot be used for the same purposes. If you get an EIDL loan and then you apply and get a payroll protection loan, the $10,000 that you get in advance will be subtracted from any amount that is forgiven under the Payroll Protection Program. It is really best to talk to your lender about which loans are best suited for your business and your needs during this public health emergency. Now, in the CARES Act, Congress also made $100 billion available to providers. And the law specifically states that eligible providers are those defined as caring for patients with known or suspected COVID. However, it is our understanding that the intention of Congress was to provide relief to all providers who are negatively affected by this pandemic, including those who have had to close their doors or have seen a significant drop in their patient volume. Now, the administration is still working out the details on how this money will be distributed. As you can imagine, the demand for these dollars are going to be very high, and that all providers, physicians, and hospitals are competing for this pot of money. In addition, the administration has also said that some of this money is going to be given to hospitals to offset uncompensated care. So there's still not a whole lot known about how these dollars will be allocated, but as more information becomes available, the Urgent Care Association will push out this information through its normal communication vehicles. Another thing that the CARES Act did was suspend the 2% Medicare sequestration. And that suspension in sequestration, or that 2% off of what you receive in Medicare reimbursement, will be suspended starting on May 1st of this year and run through the end of the year. Now, the other thing I want to talk about is the flexibility that has been afforded to providers with respect to rules and regulations, and flexibility that the administration has undertaken within its own authority. Those flexibilities that I want to cover in this webinar include the Medicare Accelerated and Advanced Payment Program, flexibilities regarding reporting for the Quality Payment Program, blanket exceptions for the Stark Self-Referral Law and regulations, as well as flexibilities with regard to payment for ambulance transportation, as well as teleplexibilities during this public health emergency. Both Congress and the administration have done a lot to allow more widespread use of telemedicine during this period of time, and that is a topic that is going to be covered in depth on a future Urgent Care Association webinar. Now I want to turn to the Medicare Accelerated and Advanced Payment Program and how it works. So all providers, including physicians, Part B providers, can apply for an advance payment of what they would normally receive over a 3-month period. And the repayment on this advance payment would begin 120 days after the issuance of that advance payment. And then physicians would have 210 days from the date of the advance payment to repay that balance without interest. And the way that the repayment works is that for every claim that's submitted, it would be offset from the new claims repay the accelerated payment amount. Now, physicians can request an extended repayment plan for that advance payment, or it can be more gradual, but the interest rate on any extension is going to be 10.25%. In terms of applying for this advanced payment program, that is all done through the Medicare administrative contractors. So you'll need to go to your MAC website, you'll need to complete the form and submit it to your MAC, and you can do that by mail or email. The application process, it has been simplified. There aren't a lot of financial questions that the provider who is applying has to answer. The most important information that will be required is that the request is based on the COVID emergency, and specifically physicians should state that they are experiencing cash flow problems due to the COVID-19 crisis. All MACs have been instructed to use physicians' claims for the period of October to December of 2019 as the basis for the maximum amount that the advance payment could be. And of course, providers don't have to take 100% of that. They could take 50% of that and ask for another 50% later. That will be up to each individual applicant. And so you can go on to the CMS website. They have a COVID resource center, and there is a fact sheet there on more information and also how to contact the MAC in your region to apply for this advance payment. In order to be eligible to receive an advance payment, a provider must have billed Medicare for claims within 180 days. They cannot be in bankruptcy or under active medical review or program integrity investigation, and the provider cannot have any outstanding delinquent Medicare overpayments. Now I want to briefly turn to the Quality Payment Program. If you are participating in Medicare's Quality Payment Program, chances are you are participating in the Merit-Based Incentive Payment System, or MIPS. And what CMS has said is that if you are a MIPS-eligible clinician and you don't submit your 2019 MIPS data by the extended deadline of April 30th of this year, then you will have all of the performance categories in MIPS reweighted to 0, and you'll receive a neutral payment adjustment for 2021. So remember that the payment year is always 2 years after the performance period. Now, if you are a MIPS-eligible clinician and you submit data on 2 or more of the following MIPS categories, that is quality improvement activities or promoting interoperability, then you're going to be scored on the performance of those categories, and you will have your 2021 MIPS payment based upon that performance. So the long and short is, if you don't report anything, you don't get penalized. And we do expect to hear more from CMS later this year regarding program requirements for this current 2020 performance year. I briefly want to touch on blanket waivers to the self-referral law. CMS is leveraging whatever it can to provide the most flexibility to providers to be able to handle patient load during this public health emergency. And so they are allowing for things that otherwise would run in violation of the Stark self-referral law. In the slide, I lay out a couple examples, including a situation where a hospital may send a hospital employee to an unaffiliated physician practice to help with staff training or with the intake or treatment of patients, or the Stark referral blanket exceptions would just allow better coordination between hospitals and other providers, or it may allow a hospital to provide things like meals or daycare or transportation for the clinicians who are working within their walls. So the Stark self-referral law is in the blanket waivers is intended to provide the maximum amount of flexibility for providers to work with each other outside of their own walls. Another thing that CMS did was to allow Medicare payment for ground ambulance transportation to all destinations, not just to hospitals, so long as those points of destination are equipped to treat the condition of the patient consistent with EMS protocols in a state or locality. And the expanded list of destinations include urgent care centers, and it will apply to medically necessary emergency and non-emergency transports of Medicare beneficiaries. And this includes a beneficiary that may be suspected of having COVID, and they want to not transfer that patient into an already overwhelmed hospital emergency department. So the ambulance could transfer that patient to an alternate destination. Of course, this is going to require some coordination at the community level between ambulatory transport providers, urgent care centers, hospitals, and other points of destination, whether it is a physician's office or an ambulatory surgery center. But what CMS is doing is saying, well, we're going to give the ambulance providers the maximum flexibility to be able to triage patients to other destinations other than already overwhelmed hospital emergency departments. The administration has also used the authority granted to it through the public health emergency to waive some requirements under EMTALA. They are fairly limited in the types of waivers that they can provide to EMTALA, but specifically what they have done is waived requirements regarding the transfer of an individual who has not been stabilized if the transfer arises out of an emergency, or the redirection of a patient to another location, including an off-site alternate screening location other than the hospital emergency department. So again, this is with the idea that as many patients as they can divert, particularly those with suspected COVID, away from the emergency department, the better. There have been a lot of questions raised about what this really means in terms of triaging patients away from the hospital emergency department to sites of service like urgent care centers. And these are questions that have been raised with the administration, and a request from urgent care center providers and the Urgent Care Association to the administration, so the hospitals have a really clear understanding of what is permissible during this public health emergency, specifically related to non-emergent transfers to other sites of service. And those are really at the moment, the key changes that all urgent care center operators, owners, and providers need to be aware of. There is a plethora of information on the website for the Centers for Medicare and Medicaid Services at cms.gov. And so I highly recommend going to that site to pull up fact sheets and other information, which is changing almost on a daily basis. This is a very fluid situation. I also recommend that you go to the Urgent Care Association website. There's also a COVID resource center set up there where this and other information will be posted and updated as more information changes or becomes available. And then lastly, before we end, I want to make an appeal to all urgent care centers and their providers to take a moment to reach out to your members of Congress. Let them know how this pandemic is affecting you from a business perspective and also your ability to treat and care for patients. Whether that is because you can't access tests or you can't access PPE, or if your volume has just dropped off and you need some financial support until things or this crisis has peaked and has come to somewhat of a conclusion. It's easy to contact your members of Congress. You can go to house.gov or senate.gov and you can search for your senators and your representatives. And once you go to their webpage, there is a button almost on every single member of Congress's website for contacting them, including through an online portal. Make sure you include your location, your name, and your contact information. And most importantly, ask your members of Congress that urgent care centers and their providers be eligible for relief and future packages that Congress considers. We do expect one, if not many more, relief packages that will move through Congress in the months ahead. And specifically, we anticipate that a next relief package is going to have a heavy emphasis on providing relief to healthcare providers. So it's really important that at this time, members of Congress hear from urgent care center operators, owners, and providers. If they don't hear from you, then you will be left out. The Urgent Care Association will be issuing some calls to action, so please look for that in communications coming from the Urgent Care Association in the days and weeks ahead. And that concludes my presentation, and I will now turn it over to Carla.
Well, thank you very much, Camille, for wading through all that information and really putting it into a digestible version for UCA members and all urgent cares out there. So I would like to, again, thank you for doing this, and this will conclude the webinar.